Complementary and Alternative Medicine by Erica Hussey. I chose this topic because I happened to be in the ER with a relative and witnessed a burn victim. I did not know much about the different degrees or types of burns, so here I am. This presentation will provide you with the tools to manage burns naturally and safely. Treating specific types of burns at home using holistic methods can be very effective. However, it may not suffice in some cases, and knowing the limits of the methods is essential. If you notice signs of infection such as redness, swelling, leaking, persistent pain, large blisters, or burns that do not heal, you should seek professional help. Complementary and alternative medicine is used to treat burns. Understanding the different levels of burns and appropriate CAM treatment for each is crucial to receiving the most effective care. This knowledge empowers people to use CAM safely and effectively, enhancing our overall health and well-being. For this presentation, we'll learn about the 3 levels of burns and the degree levels. We have first degree burn, second degree burns, and third degree burns. First degree burns, which is the outer layer of the skin, typically does not require a visit to the ER or physician. It can be treated at home, and the CAM remedies for this is a cool compress or aloe vera to reduce pain and swelling, OTC, Motrin, ibuprofen, Tylenol, APAP to manage the pain and reduce inflammation. Consult a healthcare professional if you are unsure. Second degree burns affect the epidermis, which is the outer layer, and dermis, second layer. Treatment is to run cool water 10 to 20 minutes, apply a topical antibiotic, and cover blisters with a gauze dressing. Consult a physician for medical attention for swelling, pain, and pus. Third degree burn through the first 3 layers of the skin and fatty tissue can destroy the nerves so that you feel no pain. Skin appears to be white, charred, and leathery. There will be a scar after healing. The treatment for that requires immediate treatment by a healthcare provider for pain and management, and may require skin grafts to cover the heel and burn areas. IV fluids for hydration and support healing. How to get burns background. A burn is a type of injury to the skin or other tissues caused by heat, cold, electricity, chemicals, friction, or radiation. Burns are classified into different degrees based on severity of the injury and the depth of tissue damage. According to PacMed Central and the World Health Organization, also known as the WHO, it was estimated that every year around 11 million people sustain burn injuries that require medical treatment, and more than 180,000 people, which is 95%, die from burns, mainly low and middle income countries. So what holistic approaches can we use? We could use honey, essential oils, meditation, hydrotherapy, natural supplements, essential oils, acupuncture. But what I'm going to talk about is aloe vera. In Hawaii, we call it aloe. Aloe vera's history. First AD, a Greek physician wrote aloe for its medicinal uses. Alexander the Great, in 330 BC, used aloe vera for his wounded soldiers and speed up their recovery. Aloe vera made its way by the Silk Road to China in 300 to 400 BC for burns. Aloe vera made the way to Hawaii in the 1950s. Since 1550 BC, named the plant of eternity by Egyptians for burns, wounds, and fever. Aloe was considered a sacred plant that held the key to beauty, health, and immortality, thereafter for burns. Fun fact, Cleopatra used aloe in her daily skin routine. Aloe grows wild like a weed in Hawaii, and aloe is kept near the kitchen and used in the gardens. Mechanism of action, also known as MOA. The holistic approach intends to heal a burn victim physically, emotionally, and psychologically. Article 1. Second-degree burns and aloe vera, a meta-analysis and systemic review, advanced skin wound care. Article objective, evaluating aloe vera effectiveness in the treatment of second-degree burns. The questions addressed are: what are the key benefits and effectiveness of aloe vera for second-degree burns and wound care? And how effective is aloe vera compared to other burn treatments? Article 1, Second-degree burns and aloe vera, a meta-analysis and systemic review, advanced skin wound care. Methodology, efficacy in treating second-degree burns. Comprehensive search of relevant literature, critical appraisals of included studies, and statistical analysis. The findings were synthesize existing evidence about wound care therapeutic benefits, evaluates aloe vera efficacy versus other treatments, identify specific properties of aloe vera in treating burns. Article 2, Aloe vera, an extensive review focused on recent studies. Article objective, an extensive review of recent studies on aloe vera. It focuses on its applications, benefits, properties, and potential uses in the context of food and health-related studies. Questions addressed: what are the benefits of aloe vera? What is the contribution of aloe vera to health? And what future research uses are suggested for aloe vera? So the methodology is a comprehensive review synthesizes findings from various studies on aloe vera's application, benefits, and potential in different fields, particularly food and health-related research. Findings are synthesizes findings from various studies on aloe vera's applications, benefits, and potential in different fields, particularly food and health-related research. Article 3, Effects of Arnica, Phytotherapeutic and Homeopathic Formulations on Traumatic Injuries and Inflammatory Conditions, a systemic review. Article objective is to systemically review the effect of arnica and homeopathic formulae on burns, decrease infection, relieve pain, and inflammation. The efficacy, mechanism of action, and treatment uses were the questions addressed. So the methodology is a systemic review of arnica and homeopathic formulations, search database for the other studies, findings, systemically finding arnica and homeopathic effects based on evidence from research, and gel or cream can be used. Synthesis of findings. Compare, contrast themes, patterns, discrepancies, and contrast if any. Evaluate benefits and review. So the articles evaluate the efficacy and potential applications of natural treatments, aloe vera, and arnica. The benefits, articles 1 and 2 focused on aloe vera's benefits in wound care and general health. Article 3 reviews arnica's benefits treating traumatic injuries and inflammation conditions. Review. Article 1 and 2 used a systematic review and meta-analysis. Article 3, systematic review. Article 1 evaluates the efficacy and benefits of aloe vera in treating second-degree burns and wound care, identifies specific properties of aloe vera, suggests future research directions for aloe vera in burn treatment. Article 2, extensive review of recent studies on aloe vera, discuss aloe vera's properties, uses, benefits, and potential applications in food and health-related studies. Highlights, feature, research uses, and potential areas of study, contributes to understanding aloe vera's role in health and nutrition. Article 3, a systematic review of the effects of arnica and highlights the potential benefits, and future studies should address the variability in evidence by conducting standardized trials and in the integration of arnica and other therapies. Warning: CAM therapies can be beneficial, but they should not replace conventional medical treatment for severe burns. Depending on the severity of the burns, CAM can be used alongside medical care with therapies and treatments to promote healing and reduce symptoms. Always consult a healthcare professional before starting a CAM therapy to ensure it is safe and appropriate for the type of burn. Conclusion: holistic patient-centered care and the potential for improved outcome in burn management is important. The findings are valuable. Limitations like evidence variability and a narrow focus indicate a need for more rigorous and inclusive research methodologies. Analyzing various future interventions in diverse populations will enhance the applicability of effectiveness of the results. Here are the bibliography and references. Bibliography and references continue.